Good morning, everyone. My name's Dr. Alice Saul, and alongside Dr. Laura Lasset over there and Dr. Julie Campbell, we'd like to introduce you to the new courses that we've got in development at the Menzies. So just a bit of a background on these courses. So building upon the success of the Understanding MS MOOC, the team at Menzies secured funding from the Medical Research Future Fund back in 2019. And this funding was aimed to develop new courses to complement the Understanding MS MOOC. The idea that these courses were short, that they were targeted, very focused on certain topics, and those topics were aimed to address the needs and interests of the MS community. So it was quite an in-depth process of how these topics were chosen. We, as a team, conducted a scoping review of the literature back in July 2020. We incorporated a lot of feedback from participants of the Understanding MS MOOC, and we had various consultations with those from the MS community and also additional stakeholders. So in terms of our stakeholders, I won't go through them, but I just wanted to list the state-based and international stakeholders that we did have consultations with. So as Bruce introduced, and I will do so again, the selected topics that we decided upon for the short courses were mental health and MS, deciding about disease-modifying therapies for MS. Now I'm the academic lead for both of those courses. And the rest of this talk is really to give you an introduction to these courses and also an update of where they're at. Third topic that was chosen, Ageing Well with MS, and Dr. Laura Lasset over there is the academic lead, and following my talk she will also give an introduction and an update on how that course is going. And Dr. Julie Campbell over there too is the academic lead for the fourth topic that was just decided, and that was carers and supporters. So I'd like to introduce you to the Mental Health and MS mini MOOC. It is a free online course. It is self-paced, so you can go at it as you will. A little bit differently set up to the Understanding MS MOOC, where we have two iterations, so one in March and one in September. These courses will be available. They're run continuously, so enrolments are available all year. So the course structure consists of 3 modules. We have quizzes and activities to supplement the learning objectives, and it takes around 1.5 to 2 hours per module. So upon successful completion, course enrollees will be able to explain what mental health is and how it differs from mental illness, to describe the symptoms and early signs of anxiety and depression, and also to explain the relationship between MS and anxiety and depression. We also go into some strategies for improving and maintaining mental health. So this course is currently in the pilot stage, which means that it's pretty much, it's been put together. So in a pilot stage, generally we run a study to gather feedback and input on the Australian MS community. And we gather that input on the course content, but also the mode of delivery and the timing it takes to make the course. So generally with a pilot study, we gather up all the results at the end. We have a look, we make sure that all sectors of the MS community are represented. We implement that feedback into the MOOCs, and then we officially launch the courses. So at this stage, we've reached our recruitment for the pilot, so we've closed enrolments. And we've reached a number that we feel that we can adequately implement this feedback prior to the launch. So I just wanted to show you a bit of an example of the course content that's currently being piloted. So this is what the portal looks like. Slight differences if you do the course, because I'm in the admin section. And this example of course content is really looking into mental health and mental illness, how they're different concepts, but how they're also very linked. We use a range of imagery, a range of checks to supplement our learning objectives. So this is a second example of the course content that's currently being piloted. In this particular section, we discuss finding help for mental health. We go into what is help, we all have good days, we all have bad days, but when it's, our mental health is starting to interfere with our everyday lives, it's a good time to ask for help. And, in this course, we really go into what we mean by finding help. Who can help? What is help? We go into the different resources and professionals that you may want to visit, depending on the nature of your situation. And this is an example of some of the course activities that we have in the pilot. So for this particular activity, it's about goal setting and having a positive outlook. These activities aren't marked, don't worry, you won't, it's for your benefit only, really. And the reason we sort of included these activities too was to supplement our learning objectives, but also too to sort of kind of support, I guess, some of our lived experience and clinical experts that have videos within the course as well. So particularly for this activity, psychologist Sally Shaw, who appears in numerous videos about mental health, but also too across a range of other MOOCs. She spoke about how goal setting can create a sense of purpose, sense of meaning, sense of accomplishment, and writing down these goals makes you more likely to achieve them. So you can identify what goals that you actually have and how important it is to you and the steps that you may take to want to achieve them. And that all feeds into sort of how you feel about when you do achieve them. So the second course that I'd like to introduce you today is deciding about disease-modifying therapies for MS. So in a similar way to the mental health course, it's a free online course. It is self-paced as well. We have 3 modules. Similar to the mental health, they're around 1.5 to 2 hours each, and enrolments are available all year. So this course aims to increase the understanding about DMTs, to help people communicate clearly about them, and help people with MS make informed decisions about using them. And this involves deciding about starting, switching, and stopping different DMTs. So upon successful completion, course enrollees should be able to explain what DMTs are and how they affect a person's body and MS. Our course enrollees, upon successful completion, should be able to describe the major types of DMTs and the considerations affecting a person's selection of them. We also go into a bit of content about why a neurologist might recommend switching or stopping a particular DMT. We also touch on effective communication and how that relates to deciding about DMTs and the importance. So again, this course is currently in the pilot stage, to which we're eagerly awaiting the final pilot feedback results, and then we'll implement that feedback prior to the final launch. So this is just a bit of an example of course content for the DMT MOOC. So in this particular section, we discuss what to consider when choosing your DMTs. So we give, in this sort of section, we give a bit of a broad overview. So for the number 1, the priorities and preferences of those living with MS. The second is the advice and expertise of healthcare providers. And the third, which can't quite fit on the screen, is the logistics of the healthcare system to which you are living in. And this is another sort of example of the course content where we use videos to supplement our learning objectives. So again, Dr. Sally Shaw here discusses the importance of effective communication and how that really is paramount to selecting a DMTs with your healthcare team. And again, another way we are using text and imagery for course content. So in this particular section, we really go into the priorities that someone may have when they're selecting a DMT, such as mode of administration. So if you have a fear of needles, probably don't want a DMT that involves injections, probably a more oral-based DMT if that's the route that you would like to go down. Medication schedule, so if you're someone that travels a lot for work, some DMTs may be particularly more applicable to you than others. Starting a family, so some DMTs are more suitable if you would like to start a family than others. And it's just, it goes into a lot of different detail behind those reasons. So while we're still in the pilot stage, we'll implement those results from the pilot. We would like to make sure that all sectors of the MS community are represented in those results for the pilot. But we have actually opened up enrolments for the course launch. So basically what this means is that you can take a picture of this QR code to enrol in the course, and once the course is launched, once we've had a chance to implement that pilot feedback, then the course will officially launch. So for those of you who would like to enrol, you can do so using those QR codes, and you'll get a notification when the course has officially launched. If you don't quite get a chance to take a photo of that now, I will actually be on the trade table from 2:45 to 3:15. I do talk quite a lot, so please allow yourself at least 5 minutes if you come and see me at the trade table. But if you want to have any more questions about the course content or would like to know anything more, please come and see me. Thank you. So I'd like to hand you over to Dr. Laura Laslett, who will introduce and give you an update on the online course that she's got in development at the moment. Thank you.